Good afternoon, and welcome to the Mid-America Regional Council's Local Officials Briefing for Friday, May 22nd. Today we'll take a look at the current situation and what has happened over the past week. I am Mike Parker, and I will be presenting today on behalf of the Mid-America Regional Council. Should you have any questions during the briefing, please add them to the comments section of the video, and we'll do our best to respond at a future briefing. Common Operating Picture, or COP. The KC Region COVID-19 Resource Hub is publicly available at the preparemetrokc.org. The Resource Hub is updated daily with the most current information on COVID-19 cases, tests, and deaths as reported by the 9 counties in our region and Kansas City, Missouri. The Resource Hub now includes a link to the summary of regional reopening plans to compare regulations in each jurisdiction. The document will be updated regularly as new information becomes available for future reopening phases. Why is collecting data so important? First, it creates awareness. It allows us to understand the effects on people, business, infrastructure, and the supply chain. Next, it enables decision-making, especially in terms of resource allocation, public health, public safety, and efforts at mitigation. It empowers decision-makers on where their efforts and resources are most needed. Next, it anticipates the cascading effects. This is where small effects can trigger a larger impact on lifelines and systems. Next, it helps us to assess outcomes, how well or how poorly our efforts and resources are at achieving our desired outcomes. And lastly, it helps us to adjust efforts to be more effective and more closely achieve those desired outcomes. Today, there are 4,644 confirmed cases of COVID-19 in the region, and there have been 185 deaths. This represents an increase of 497 cases and 17 deaths over the past week. The number of people tested in the region rose to 39,810, but numbers are incomplete since not all counties are reporting. This represents an increase of 9,640 people tested over the past week. This is a look by jurisdiction of cases and testing. This week, we had 5 jurisdictions with a greater than 15% increase in cases, but the increase in the region dropped to just below 12%, down from just under 16% last week. Note that Leavenworth County still has a case rate that exceeds 1,000 cases per 100,000, which is significantly higher than others in the region. Testing results are still incomplete since not all are reporting, but of those reporting, Clay, Jackson, Johnson, and Platte counties are showing less than 10% positive test results. This is a look over the past 2 weeks of case counts and trends in the region. This is a picture of the Healthcare Coalition Northern Southern District's COVID-19 Resource Hub, which shows a similar map for additional counties in the Missouri Highway Patrol Region A. On Tuesday, May 12th, the Multi-Agency Coordination Group met to discuss our collaborative response efforts now and into the future. The MACG, as it's called, is scheduled to meet again on May 26th. Additional information about these public meetings is available on the public meeting calendar at www.marc.org. Strategic objectives. Discussions and future action are guided by the strategic objectives. Data supports achieving our strategic efforts in many ways. Save lives, knowing when and how to avoid contact, where and how to get testing and treatment, and knowing the most accurate, reliable source of information. Protecting the population, knowing where the disease is, where it's most likely to be, and where or what activities to avoid. Having enough personal protective equipment for everyone to do their job. Third, cooperate and coordinate. Data lubricates the decision-making process and allows decision makers to assess their needs in relation to the needs of others, allowing for the best solutions for all. And fourth, plan for the longer-term recovery. There is a larger, longer-term impact now and on the horizon. Housing, infrastructure, personal finance, business, governance, and trust, to name a few. Lifelines. The status of all 7 lifelines throughout the region is green, but all are hampered by a shortage of personal protective equipment where the consumption rate is exceeding the supply rate throughout the region. Otherwise, all lifelines are functioning as required, with no mission-critical shortages of personnel, equipment, or supplies forecast for the next week. Now, I will provide a brief update on supporting functions and disciplines. ESF8, Public Health and Medical Services, Public Health Reopening Plans. In Missouri, the first phase of the Show Me Strong Recovery Plan started Monday, May 4th. Phase 1 will extend through May 31st. In Kansas, the first phase of Ad Astra, a plan to reopen Kansas, started on Monday, May 4th. Phase 1.5 went into effect on May 18th, with a modified Phase 2 to begin May 22nd. Locally, we continue to monitor all counties in all phases. On May 20th, Wyandotte County announced a temporary suspension of the Restart WICO plan and adoption of the state Phase 2 plan to align with the state of Kansas. On May 22nd, Jackson County announced that they are going to their Phase 2 on June 1st. Residents and businesses face a dynamic mix of state and local guidance regarding the reopening of businesses, activity venues, and other key segments of the community. Plans are dynamic because both the spread of the virus and its effect on the community are dynamic as well. Timing of phases, as we've seen them, is subject to change based on public health considerations. As a result, all of the plans take a phased approach, continuing to emphasize social distancing while paying attention to vulnerable populations and appreciating the delicate balance between public health and economic activity. In the current stage of the pandemic, the most useful data needed to understand the extent of impact of the virus on the region comes from testing and contact tracing. Significant work continues across the metro to increase availability of testing and contact tracing. Please consult your local health department website to find the latest information on testing locations and who's being tested. Links to all websites are available on the Prepare Metro KC website under Public Health Resources. Testing. There are 2 kinds of tests available for COVID-19, viral tests and antibody tests. A viral test tells you if you have a current infection. An antibody test tells you if you had a previous infection. Contact tracing is the process of identifying and notifying people who have come into close contact with someone who has tested positive for COVID-19. Contact tracing, a core disease control measure employed by local and state health department personnel for decades, is a key strategy for preventing further spread of COVID-19. To be done effectively, contact tracing requires people with training, supervision, and access to social and medical support for patients and contacts. Identifying contacts and ensuring they do not interact with others is critical to protect communities from further spread. If communities are unable to effectively isolate patients and ensure contacts can separate themselves from others, rapid community spread of COVID-19 is likely to increase to the point that strict mitigation strategies will again be needed to contain the virus. Hospitals. Staff report they still have COVID-19 and persons under investigation patients in area hospitals, although the state of hospitalization has decreased. However, with hospitals increasing elective procedures, surge capacity is decreasing. ESF6, Mass Care, Emergency Assistance, Temporary Housing, and Human Services. A number of facilities are established around the region to provide testing and resources for homeless and vulnerable populations. The Greater Kansas City Coalition to End Homeless maintain a COVID-19 resource listing on its website at www.gkcceh.org. This is ESF6's common operating picture. Just look at the enormous support provided from all sectors of the community. Thank you for being part of the solution. It's making a difference. This is the ESF6's common operating picture. Just look at the enormous support provided from all sectors of the community. Thank you for being part of the solution. It continues to make a difference. ESF7, Logistics, Personal Protective Equipment. Federally qualified health centers and long-term care facilities are still reporting shortages of personal protective equipment. We continue to update a list of potential suppliers of personal protective equipment, and this list is sent out weekly to regional partners, including first responders and healthcare organizations. ESF14, Community Recovery. ESF14 is monitoring and assessing needs in support of reopening and for the longer-term community recovery in the areas of childcare, employment, utilities, and housing assistance. ESF15, Emergency Public Information. As you enjoy the holiday weekend, please stay safe. Practice social distancing wherever you are, and keep yourself protected and help protect others. Please remember that while some relaxation is underway, there is a need to continue practicing the highest level of protection for those individuals at higher risk. As a reminder, here's where you can find more information on the web. This week we've added Come Back KC. Hashtag Safe Return KC. As the greater Kansas City business community adjusts day-to-day operations in response to COVID-19, we must balance the need to maintain our region's economy with protection of our community's health. The KC Chamber, KC Area Development Council, Civic Council of Greater Kansas City, and Mid-America Regional Council are working together for hashtag Safe Return KC. You'll find more information at preparemetrokc.org. In closing, we remind you that we're posting these periodic briefings to the Prepare Metro KC YouTube channel. Please subscribe to the channel and sign up for alerts to receive notification of future briefings. We'll monitor comments posted to the briefing videos for questions we can answer in future briefings. Thank you for your attention. This concludes our briefing.